Thanks, Fred. Today I'm joined by Susie McIntosh from Focus for Success. Welcome, Susie. Thank you so much for coming along today.
Jenny, thank you for having me on.
I'm delighted to have you here. Now, I believe you are a coach working with adults who have ADHD. Can you just explain to the audience, first of all, what is ADHD?
Of course. Adult ADHD or ADHD is a unique form of brain wiring. It's something that in childhood is seen as impulsivity or distractibility, areas of forgetfulness, difficulty sitting still, most people would say. Sometimes it can be that child that's as vague as a violet in the classroom, just watching the spiders crawl down the window. And in fact, it continues all the way from childhood through to adulthood. Some people manage to live with it really well and manage to live with their adult ADHD and give it their best possible. Others get lost within the system, and it turns up later on in life when life becomes that much more difficult or fragmented.
Because I think many people wouldn't be aware that it's actually a condition which affects adults. I've always thought it was primarily a condition which affected children, but clearly that's not the case.
Oh, absolutely not. The vast majority of the clients that I have actually come to me as adults, and they can come to me from the age of 18 through to 82. So it is, as life becomes more complex, symptoms become more severe, or it may be that they're picked up because of anxiety or depression, and life just isn't going well for them. Come to somebody like me and we start to sort it out.
So what you're saying is that sometimes it may not actually be diagnosed until they are actually an adult.
Absolutely, and the vast majority of adults don't actually have a correct diagnosis. So that makes it even more difficult from a management perspective from other allied health practitioners.
Right. So you've mentioned some of the symptoms that some people might experience. Are there any other sort of things that might show up, or what are some of the difficulties that people are experiencing if they have ADHD?
People come to me because they're having problems with relationships, they're having problems in the workplace or at school, they're having difficulty studying, they're having difficulty maintaining focus on what they need to do, that they're in a place where they thought they would be somewhere further on. So a 26-year-old may come to me thinking that by this stage in life he would have a career and a partner and so on, and in actual fact is still having difficulty getting through school. Or it might be an executive who's actually having struggles at work and having difficulty with co-workers and can't quite work out why he's not getting to the place that he needs to get to.
So it sounds like sometimes it could be quite tricky to pick up if somebody does have ADHD, because it seems very similar to some other sort of problems that people might be experiencing.
Absolutely, and it comes down to really understanding the history, going back and looking at the whole person and mind-body person, and then just seeing exactly where they are having their difficulties and sorting out a puzzle. It's a bit like a jigsaw.
Right. So if somebody comes along to see you,
yes,
what sort of things would you be doing with them initially?
Okay. Firstly, I'd be asking them for their history, and I'd be looking at their schooling, and I'd be looking at relationships and how they're doing at work or how they're doing at school. I would then be looking at what their diet is like and what exercise regime they might have in place. Have they actually gone for a clinical diagnosis? Where are the difficulties that they're having? Why is it that they're having anxiety or depression or obesity or all those sorts of other issues? And from that tangled web, then we start to look at management strategies and techniques.
Okay, so is it fixable? Is it something that you can sort of take away?
No, you can't take away, nor would you want to, because it actually has many, many great strengths. ADHD is a unique form of brain wiring, and with it becomes the enormous strengths and also great weaknesses. It's quite a paradox. So we definitely want to keep the great strengths and keep those going. And when it comes to weaknesses or problems and difficulties, we can work with coaching and hypnotherapy, because I'm also a hypnotherapist. We can to actually deal with symptoms and problems, and then we can actually look at life management skills. And then if medication's required, we can actually speak to clinical diagnosticians and organise medication. So yes, it's actually quite a long process, but no, you wouldn't want to take it away.
Okay. Can you describe what are some of the strengths that some of these people who have ADHD actually possess?
Oh, extraordinary strengths, amazing strengths. So say, for example, you will find lots of ADDs are in areas of crisis management. So you'll find them amongst paramedics or fire brigade, or you'll find them as the doctor who's in ER, somebody who really copes within a crisis. They may be highly intuitive, highly creative, people who are absent-minded professors at university. You know, those people just become just so focused on what they're doing, and the rest of the life really doesn't matter much to them at all. Or there might be a mum at home, you know, who is managing to cope with half a dozen children, and people say, how do you manage? Because she just seems so calm and so serene. But underneath the surface, she's actually really struggling.
Right. So what would be some tips that you might share with the audience today that would help them if they were suspecting that they might have an issue with ADHD?
I think the first thing is actually to get a good diagnosis. Go and find somebody who actually knows what they're talking about. Okay. Go and speak to somebody who isn't critical or judgmental. Then from that, organise to have a proper diagnosis if it feels warranted. I would also then be looking at tips. I'd be looking at coaching and hypnotherapy to sort out problems and symptoms. And life management skills. I'd be looking at exercise. It's really important to have an hour's exercise a day, but very specific sorts of exercise. I'd be looking at meditation and yoga. I'd be looking at diet. I'd be looking at nutrition. And I'd be looking at electronic apps and things that can actually be put into place to actually support you in whatever it is that you're planning to do.
So it sounds like a pretty comprehensive form of management that you offer people.
Oh, absolutely. It's total mind-body management. Yeah. And I like to see it as being really holistic management.
Great.
Yes.
So if somebody wants to find out more information from you, how should they find out?
Okay. For the moment, you can look me up on the web. My name is Susan McIntosh, so it's easy. It's susanmcintosh.com. And I'm really happy to answer any questions.